Daniel Harrogate's Wellness Wednesday with O'Connor Chiropractic, optimizing the health potential of every family through chiropractic care.
Dr. Jason, good to see you once again. Now, there's a lot of information about the vagus nerve at the moment. It's something that I keep hearing about. Can you tell us a little bit more about it and the role that chiropractic care can actually play in helping things?
Yeah, I think the vagus nerve is a very important nerve. It's one of the cranial nerves. So it comes off the brainstem at the top of the neck. There's two sides to the nervous system. Your body's going to be in a state of either sympathetic dominance, which people know is maybe fight or flight, or parasympathetic, which is when the body's more in a calm, relaxed state. The vagus nerve roughly controls about 75% of the parasympathetics. So what we find is if there's dysfunction in the upper part of the neck that will negatively impact the vagus nerve, we get an overdominance of sympathetic firing in the nervous system, and the parasympathetics are kind of down-regulated. So what chiropractors have known for years, a very common side effect of when people get adjusted, and we get this on our feedback, because when we do re-exams with patients on a regular basis, we ask them to tell us the changes they've experienced. And even though they may come in with back pain, neck pain, headaches, pretty much all of them will say, gosh, I'm sleeping so much better, or my digestion's better, or I'm just not getting coughs and colds anymore. And they're amazed. They think it's a miracle, but actually there's a real big neurological basis to it. And I think it's becoming more and more in people's consciousness. And a lot of these things, well, you see what I've got on my wrist here of Whoop, there are others available, but they're measuring HRV, heart rate variability. And we know that when our cortisol, our stress levels are higher, that really impacts our HRV, which then impacts our quality of sleep. So we actually measure that as one of our parameters when people first come in to see how much fatigue their body is in, what their cortisol levels are, their adrenal fatigue, how well their vagus nerve is kind of firing. And then we make the adjustments, the intervention to the nervous system. By releasing pressure off the upper part of the neck, we can actually get that vagus nerve firing a lot better. And then we see this cascade of positive effects to the patient.
Is there any set period of time that you need to reach that maximum potential of the vagus nerve, or is it dependent on each individual?
It's very much dependent on each individual, what stress, what trauma they've been through. So probably the biggest impact we have with affecting the vagus nerve is in babies, in newborns. So one of the most stressful things your nervous system ever goes through is birth, even in a natural birth, but especially if there's an intervention like forceps, 1-2s, emergency C-section, breech. And we find that creates a lot of torsion on the upper part of the neck. This affects the baby's brainstem, and it can directly impact that vagus nerve function. So these are the babies that are colicky, reflux, irritable. I always can tell when their vagus nerve isn't firing because you've got that flexed, tensed babies, the tone, they're in that defense posture, that fight or flight. And then once we start doing some very gentle corrections, we see immediate kind of changes where the baby just starts to relax. They're often constipated, so that they start emptying their bowels properly. They start latching and feeding, because when their body's in this stress defense state, it's all about survival. Because it's in survival, it hinders growth and development, and the baby doesn't thrive. When we remove that interference, we see that baby then thrive. And again, their immune system's shot. So these are the babies that get ear infections, and they're on antibiotics. And it's just this cascade effect that you see. But actually just restoring that back to its normal state. The body is designed to be self-healing, self-regulating. And it has this amazing network of nerves that are kind of controlling that. But if there's any interference, that will hinder. As chiropractors, that's what it's all about. It's about removing that interference, taking that away so the body can express that natural health that it's designed to.
Getting it away from that vicious circle that has a negative effect as opposed to a circle of positive effects and the chain reaction that just goes on for, like you say, for the body to do what it should be doing.
Yeah, otherwise we start chasing symptoms, and nobody wants to be on medication. But I see case of case where they're coming in, and because the body's in this stress state and that vagus nerve's not firing well, and you're getting these effects like the poor digestion, poor energy, headaches because they're in that tense state. So they're coming in, they're on headache tablets, migraine tablets, they're on antacids, they've got on sleeping tablets, they're on antidepressants. One of the number one reason people take up time off work is because of stress. So you just see this like knock-on effect on them and their family and society as a whole. So it's just understanding, where health comes from. And you're not going to get health from a pill. It may calm down symptoms, but it's not going to restore the body back to its natural state. And that's what really, as I say, as chiropractors, that's what we do at the clinic every day, is seeing where that person's nervous system is, why it's under stress, how can we remove interference and get it back to that normal health.
All the different cases that you've seen, Jason, have you got a specific example that springs to mind where chiropractic care and what you and the team have done has really helped that individual's vagus nerve?
There was one particular patient, she was quite chronic, so Jackie, she springs to mind because she had a break-in into a house. So someone broke into a house in the middle of the night, and obviously huge stressful impact on her body and her nervous system. And after that event, she never slept. As soon as she went to try to go to sleep, it was like PTSD. So her vagus nerve wasn't engaging. She was in this sympathetic dominant fight or flight. But yeah, she was literally getting a couple of hours a night. She started care and she had other things going on, back pain, neck pain. We started adjusting it. And then again, it came to a re-exam. She said, I just can't believe how well I'm sleeping. And she'd gone from very broken, light sleep, couple of hours. She never used to set an alarm, but now she has to start setting the alarm because she's been late for things because she's actually sleeping all the way through. And she's now back to getting a good 8 hours sleep from 2. So I always think, that was a classic example where her body had been stuck in that sympathetic dominant for years. And she didn't actually seek our help for that, but from inadvertently, the chiropractic care shifted back to that more relaxed parasympathetic state because her vagus nerve was firing properly.
Love it. Well, if you want to explore chiropractic care for yourself, then you can get in touch with Dr. Jason and the team via the website.
Your Harrogate's Wellness Wednesday with O'Connor Chiropractic. Book your initial consultation now at o'connorchiro.co.uk.